I'm Dr. Larry Earl here, Urgent Care Mentor. In this video, we're going to take a look at how we go about doing the occupational medicine market analysis. And I'm going to go right into this tool that gives us the employer demographics of a certain area. When you're in the Achmed Booster Dooster workshop, this is in the first session. So let's walk through this. What we're going to do is we're going to come over here and we are going to search by zip code. Okay, it finds our zip code, so we come down here and we pick. Perform the analysis on this area. And what do we want? Well, we want work determines whether the selection is analyzed on where workers live or where they are employed. Okay, we want to know where they're employed. So based on work, the analysis type determines the type of results that will be generated for the selected area. We're going to look at all workers, and we're going to use the latest year the data is available, 2014. And we're going to look at all jobs. We're looking for the total number of employees in this market. Okay, so we click go. Now it's going to do this first pass analysis. And then we're going to tweak it a little bit. Okay, so what we see is just the data for this particular zip code. Okay, and this is my hometown of Rancho Mirage, and there are only 14,000 jobs total in this little town. But what I want to do is widen the selection area. Okay, so we're going to come over here to selection, and we are going to use a radius of 4 miles, let's say. Now, radius, you can use whatever is reasonable for your market. If you are along a highway, for instance, and you know that it's easy for some employers to send their employees or injured workers or new hires to you for drug screens and physicals, then you want to widen that radius to make sure that you're encompassing those areas that you know you can reach. So let's start with 4, all right, and then what we're going to do, confirm this selection, add advanced selection. Okay, so now here's our 4-mile radius. This was our original zip code area. So now we want to use this selection. And we want both areas. Okay, so now when we go out to that 4-mile radius, we can see that we now have 64,000 employees in this area. Okay, and maybe I know that I can draw from Greater Palm Springs right along Route 111 here. But this looks like a pretty good area. This takes me out to Indian Wells and to Cathedral City and to maybe half or a third of Palm Springs. Okay, so that's 64,416 total jobs. And then I can look over here and I can see, well, what are the different sectors that are that comprise this amount? And I'm usually looking for areas that are like construction, 4.8%. That's pretty good. Retail trade, it's kind of high there, and it's not great for a whole lot of injuries, but there are a lot of drug screens with retail trade. Transportation and warehousing, again, kind of smallish, 2%. Professional scientific, 3%, not great for Achmed services and workers' comp. Waste management and remediation, 8%, that's pretty good. Educational services, healthcare and social assistance. So there are a couple of hospitals, big hospital right in town, Eisenhower Medical Center, so that's probably going to be most of those folks. And accommodation and food services is great. So there's obviously lots of hotels and restaurants in the Palm Springs, Rancho Mirage area. So that's 20% of the population. And those are good for injuries and sometimes some other services. Okay, public administration, so municipalities is usually a good place to go, Board of Education, that sort of thing. Educational services, again, 4.2% of the worker population. So Board of Education and municipalities is always a good place to go to get those employees involved in your pre-placement physicals, drug screens, and workplace injury programs. Okay, so now once we have this 64,000 number, we want to determine a couple of things. Number one is that's the total market. Well, what other providers are in this 4-mile radius that are going to be competing with you? Because we need to know how should that 64,000 be broken up. Okay, so we can see, we can look at these zip codes here in this 4-mile radius, and then we can come over, we open another window here. And I'm just going to use, we could use a couple of different sources here. I usually check this, and I'm going to check Google. And we're going to come over here to facilities. We're going to put in the zip code. We're going to look at urgent care centers. Okay, so we've got one here in Rancho Mirage. We've got an express clinic in Cathedral City. We've got Desert VIP Urgent Care, Desert Regional Immediate Care, another VIP center in 3.9 miles. So we're going to take a look at the map. Palm Desert Urgent Care Center. So there's quite a few. Now I'm just going to come over here to our Occmed Analyzer sheet. There's several sheets with this Occmed Analyzer projection worksheet. The first one that I'm going to use is the zip code analysis. And so primary zip code, we're going to put in 92270. And let's see, we said the total number of employees was 64,416. Oops, that didn't go in the right spot. 64,416. Take that out of there. Okay, and then let's put in the contiguous zips, but I'm just going to leave the total employees right here because it already encompasses these other zips. So let's just go sort of clockwise here. So it's 92234, 92276, 92211, 92210, 92260, and 92264. I'll how much I have here. 92264. All right, and then we're going to make sure that we look for the competition in all those zip codes, and we know how many are providing Achmed services. Okay, so let's go back. I'm going to fast forward through this next part of the process, but basically what we're doing is we're using iTriage and Google, very simple, free tools, to identify the other urgent care centers in the area that are doing occupational medicine. And you'll see that sometimes it's listed right on the websites. We're just going to quickly fast forward through this. And sometimes you have to call the offices to see, even though they're listed as occupational medicine, or they might have that as a specialty, are they actually with another urgent care center and that's where they provide those services, or are they an additional competition site? And then we're going to wind up with, in this example, we're going to use 4 other centers that are providing occupational medicine in this market area. So let's just zip through all that and we'll get to the financial analysis. Okay, so let's call it 4 for now. So if we have 4 for this population of 64,000, and you're going to be number 5, that gives us a market share, potential market share of 20% of that 64,000, right? So there's 4 competition plus whatever your center is proposed to be, so that's 5 altogether, 20% market share. So your market share would only be 12,883 individuals. So let's go over here. Now, this is the sheet that does all the analysis for us. So this actually should be equal to this 20%. Just putting in the market share here, okay? So we've got the total number of workers is 64,000. Our market share, just on an even basis, would be 20%. Okay, so what this does is I just plugged in those 2 numbers, and this shows us for workers' comp injuries, initial injuries and revisits, and then physical exams, pre-placement evaluations, OSHA exams, other types of exams, fitness for duty, which would include things like DOT physicals and other exams. To give total physical examinations, your total drug screens for this population, breath alcohol, lab tests, pulmonary functions. So all this data comes from years of collecting it from a Department of Labor sources and other occupational medicine related sources, and then I've compiled these into a spreadsheet to give a general overview of what the market should look like. So the annual total number of visits would be here for all these different types of exams for this market. So total exams would be 1,269. Total number of drug screens expected for this population would be 3,736, and then all these other tests. So per month would be breaking down here, and then the market share, what's 20% of that? What should I expect in my office would be this column. And then I'm going to price these out. What are my fees for these services? So I'm going to put that number in here. These are just some sample numbers. So whatever your price is for these services, plug them in here, and that will get what your expected revenue per month should be from these services, and then what you should expect to get for an entire year. Okay, so if you're in this market, or you want to be in this market, you would expect to be able to get 20% of the market share if you were doing, a decent job on your marketing, and that would be $184,000 in occupational medicine revenues. So if you had a brand new program, you were already in this market, and you wanted to know, well, what's my potential? What could I get? That's the number you're looking at for this number of competition and that population of employees. Okay, and then there's a lot more here. We look at what would it take to ramp that up over an 18-month period if you were out marketing these services. That's what all this is. We're not going to go into that right now. And we even go down here and determine what your staffing needs to be for that. So we have what the physician hours would be required to see this volume of patients. What are the mid-level hours? How do you break that up? What are the nursing and MA type hours that are needed? So we break all that down and plug in your hourly rates, and then you also determine, well, how much capacity do you have? Are you already seeing these? Do you already have a volume of patients, but you have some excess capacity? You can take, 176 more patients in a month without increasing your staffing, in which case it's not going to cost you anything extra. It's going to be all profit, right? So down here, you'll be able to tell profit without adding staff would be this month on a monthly basis, versus if I had to add staff to see these patients, then my profit's only going to be this much. Okay, so you can determine based on what your capacity is, what this extra volume of patients is going to cost you in terms of adding additional staff. Okay, so it's a very fairly sophisticated way to figure out what you're going to make, what your potential is. Okay, that's all I wanted to show you for today. This is how we're going to start the Achmed booster program with this type of an analysis. And obviously there's lots more. You can see the full curriculum as well. And I hope you'll join us.